Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and today we're going to look at a mantle cell lymphoma where
Oh,
the mantle cells have made their way into the peripheral blood.
yes. And we've had lots of lymphoma patients come through the lab, and there's different degrees. Sometimes these patients they actively have disease, but like the peripheral blood really doesn't show much of the actual offending cells. So um
Well, that's because lymphomas are in the lymph tissue,
right
not
in
the
the lymph
peripheral
nodes.
blood. Yeah.
Yep.
So usually a lymph node, but any of the lymph tissues. It doesn't necessarily have to be a lymph node.
True.
So outside the peripheral blood, and usually it's stage 4 once it makes its way into the peripheral blood, of course, among other things. But one of the major signs is it now being in the peripheral blood bone marrow.
Yep.
Frequently, when we're dealing with some of these non-Hodgkin's lymphomas, some of them are going to be more prone to becoming in the peripheral blood and or not, and then we might not see it at all. And then in that case, we would have nothing to talk about.
Yeah.
But and then when you're looking at these, they're going to share the same CD markers and similar cytogenetic markers. And so that's the importance, right? Is we're not going to look at a cell and say, this is a mantle cell lymphoma in the blood. We're probably not going to know that by looking morphologically. It'll be those more specialized testing that'll really tell us that it's mantle cell lymphoma cells that have made their way into the peripheral blood.
Yeah, I mean, at best, you'll have some intuitive sense like, oh, that cell's not normal, right? But these are generally mature looking lymphoid cells. So this is tricky. So we settled on this fella here. So one thing I notice is generally mature pattern, chromatin pattern, but we do have something of a nucleoli kind of pictured here in the corner. Oh, geez, I did it again. Yeah. So we see that nucleoli. And then the other thing I think that's important to note too, I'm going to draw the arrow further away. Hopefully it doesn't superimpose. But in the corner, that little dip into the nucleus. So not uncommon for a kidney bean shape, but that little dip and that fold looks strange to me. Does not look like a normal morph.
Yeah, the indent, you see that in CLL a lot too,
Yeah.
where the cells are indenting like that. So it's, looking at it, depending on what the rest of the picture looks like, we'll have to look around and see. I think more than anything, I wouldn't think mantle cell lymphoma. I might think CLL.
Absolutely. I agree with you completely. Yeah.
I mean, the other thing with the really prominent nucleoli, we might think PLL, or that there's prolymphs present in the CLL.
Yep. It's definitely, I'd be on guard at seeing this. Yeah. Cool. So other notes, I guess, not a lot of platelets.
Yeah.
Which is usually indicative of some kind of a larger disease.
Well, that's interesting because with your mature lymphoid neoplasms, you don't usually have quite the thrombocytopenia.
Right. At least initially at presentation, right? So what does that tell us, do you think, if the platelets are this low clinically?
Well, I guess because they're mature lymphoid cells, it could be antibodies against the platelets, right? And they could have some decreased process.
So lymphoid neoplasms and autoimmune disease are like bread and butter, right? They just kind of go together. So, yep.
And it doesn't necessarily have to be red cell autoimmune. That's the one we think of. We think of autoimmune hemolytic anemia, but it could be also antibodies against platelets. So it could be that, or it could be that, the bone marrow has been taken over. You have a myeloproteic anemia and you're not making platelets as much. So it could be a few different things.
True. Yep.
It could be that the specimen had platelet clumps.
Yeah, true, right? They're pre-analytical.
We don't see those yet, though. We don't see any clumps in here, so
yeah.
not that. And then some echinocytes.
Yes, definitely notable echinocytes in this particular field. So we'll see if that holds true as we look around. But yeah, notable.
Yeah, and then in general, I guess the rest of the red cells look normal, although do we really compare we usually compare it to a resting lymph. Is a mantle cell a resting lymph? Probably not. So it's
That's a
kind of hard to
great
say.
question. Yeah, that's a great question. I always kind of struggle with macro, micro, and area and how anemic the patient is, right? So anemia makes it difficult to find that appropriate area to. So there's a lot of like compounding variables. I love having an analyzer to tell me that kind of information and to correlate. That's my favorite thing, but
Yeah, it's helpful.
it's helpful, definitely helpful. So let's see what else we find. Okay. So a shaggy cytoplasm, you know.
Wait, is it a hairy cell?
Yeah, I know, right? Hey, low platelet, first cell I look at, why the heck not have that on your radar, right?
Yep.
100%. This would be a very unlucky individual to have both.
I don't know that I've ever heard of both.
Yeah, I know. Having two malignancies at once is pretty rare. So, but hey, but no, I wouldn't jump to it, but I certainly would be keep my mind open
Yeah.
to possibilities.
So I don't really see quite the prominent nucleoli like we saw before.
Agreed.
I don't know that they necessarily have to have prominent nucleoli. I think they can, but I don't think they have to.
Mm-hmm.
And
Yeah, so I'm just looking for any kind of
yeah,
abnormality.
there could be an indent here, but again, it's not quite as prominent as before. So
Yep.
I
Yeah,
think you,
some of the mantle cells we've seen kind of like fold in rather extremely, right? So
yeah,
we'll be paying attention. So yeah, I mean, at this point, I might just be going lymph on this fella
yeah,
until I feel more comfortable.
yeah. He also looks like he's a little bit smaller than the other one.
Hmm.
So I'm wondering if this is actually a round resting lymph.
Plausible. Yeah, I would say that the mature lymphoid stuff, it definitely has the highest like learning curve. Okay, okay. All right. So it I'm paying attention to the nucleus, the shape, right? Kind of draw, I'm trying to find cytoplasm. There's not a lot of cytoplasm there, which I think is kind of a red flag in some morphologies. Um, really tricky. What are your thoughts?
It kind of reminds me of the last one that we just saw.
Yeah, yeah. There's not a lot to go off of here.
No nucleoli. I don't really see an indent in the nucleus.
Right. So I think the other thing to pay attention to is the contours of the nucleus. So I'm trying to be sensitive to everything. But I don't know.
He just kind of looks squished, honestly. Which is
Yeah,
weird.
well, that's the thing. I mean, it could be a little bit about its physical orientation, proximity to other cells. But nothing definitive. So at this point where we're trying to assess whether or not there's a malignancy, I think I put a lot of stock in making an abnormal kind of morphology present itself. So maybe we be conservative here and just say lymph and then kind of keep fishing.
Yeah, and then two other things. There's platelets.
There are platelets. Look at that.
Some platelets
Yeah.
here. And then this thing here is just junk. This
Yeah.
like, weird transparent thing.
Shadow.
Yeah, it's just junk. All right, let's go.
Right. Ooh. There was something else.
There was something else.
There was definitely Maybe go to a lower power and see if you can spot it.
This one? Ooh.
Hello. Okay, so this is really cool. So, couple things going on here. Horseshoe shape, right? So, morphologically on the nucleus, kind of a monocyte looking thing, but cytoplasmic, So that, look at that basophilia at the edge there. Fascinating. This is very, very abnormal to my eye. I don't know about what your feelings are, but
Yeah, it almost has like a reactive feel to it, except the shape of the nucleus. Usually they're not
and the
shaped.
way the color drops off too, isn't that a little suspicious? I think most of the time the blues start to light if it
It
bleeds.
radiates. Yeah.
Yeah, it like goes evenly. This almost feels like it fell off a cliff in
Yeah.
color. So this is definitely like a ding, 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 ding. Something's going on here.
Yeah. And like because it's a mature B cell neoplasm, whenever you see the dark coloration to a B cell, you're thinking it could be moving towards a plasma cell. You're thinking, well, it could be RNA or it could be immunoglobulin. So again, if we're dealing with an abnormal malignant B cell, could be starting to create antibodies and
Doing B cell things, right?
yeah.
This might not be a bad. I just want to throw it out there. Maybe snap a picture.
Yeah, he did.
She's so good. Melissa's so good. Awesome.
If we ooh, I just assume I've taken a picture.
Noted.
Well, let's
Oh,
find that other one that I stopped at before.
yeah, so sorry to steal the thunder, but that one, like, okay. And now we can use that other cell to inform us as we now look a little bit more, right? So I see that that folding, little bit of a shaggy cytoplasm. Nothing crazy going on in the nucleus though, right?
Nope.
So yeah, I'm kind of in between and iffy. There's something that happens, like that cell that I just saw now makes me like itchy. um, but yeah, I am not nearly as abnormal as the last cell.
This one just looks like it's starting to be reactive to me.
Absolutely. Yep. Yep.
Not quite reactive, but
But so this is a good opportunity too to kind of talk about the color change in
yeah.
that corner, right? To me follows a pattern that's I expect to see. It's darker and then it goes lighter.
Yeah.
The other
Compared to
cell was like it was like night and day.
this one, compared to this
Yes.
cell that we were
Yes.
just looking at. Yeah, the drop off. You can see the drop off here as compared to the cell we were just looking at. Go
Yep.
back. Go back. Now it's like, no, I'm staying here. Come on. Oh, it's thinking about it.
Fair enough. But yeah, the I'm glad that you swapped back and forth, even though it's giving you a pain, being a pain right now. But yeah. I'm also looking at this one too and noticing on that left-hand side now the cytoplasm's got that fuzzy kind of texture to it.
And then you can see here where it's not quite dropping off. It's going to a lighter shade.
Yeah, yeah. So much more normal staining characteristics in the cytoplasm.
Yeah.
I'm still very, very suspicious, if I'm being honest, just looking at
Yeah.
the shapes and contours of the nucleus.
Well, in parts because we know something's going on.
Right.
But just seeing in a vacuum this one, I would probably think he's just becoming
Yeah,
reactive.
yeah, I tend to agree with you too. Yeah.
And he might be. Who knows? If he's just a normal lymphocyte and this is a sick patient, who's to say that they don't have a cold or something else giving them reactive lymphs? But it could be given, especially the other cells that we've seen, it could be more of a malignant cell.
Yeah, there's so much uncertainty in morphological characteristics of this type of lymphatic pathologies. So yeah,
That's why
I
flow.
like blasts and AMLs and ALLs infinitely easier in my opinion.
Yeah. Oh, yeah. I always say lymphocytes are the bane of our existence.
Cool. So yeah, this looks like a pretty normal-ish sort of there's like some vacuoles in there, I guess, but
Yeah. Vacuole. But then isn't it a mono?
yeah. No. No.
Yeah, but I agree. I think he's just normal.
Yeah. I don't have too many weird feelings about him.
Oh, the end. Let's keep going. The end? He's in. Okay.
Yeah. And crazy, right?
Yeah. Just, I feel like the chromatin pattern is really pronounced,
Mm-hmm. Yeah,
which is interesting.
yes.
But otherwise, he does look like a normal lymph.
Yeah, like I feel like he's not a bad looking one overall from what we're seeing. Be inclined to just call lymphocyte on that one. Hi there. My name's an abnormal cell. Nice to meet you. So this one I feel pretty comfortable putting into my other category, would probably be the category I'd be using at this point.
Yeah.
So vacuoles, the NC ratio, honestly, the nuclear pattern is not like terribly troubling in itself, but all the pieces together to me don't fit. They don't make sense, right?
I was
I
trying to
think
see if it was indented or lobulated, and I'm having a hard time telling even in the scope.
Mhm. Yeah, because I mean, I don't know, but to me, there's enough kind of going on in here that's unusual.
The other thing is he's much larger than those other cells that we saw that we called resting lymphs in the beginning.
Yep, he is quite large. So yeah, I mean, this particular chromatin pattern wouldn't be strange to see in something like a monocyte, maybe, or something like that. But the fact that this is this high NC ratio cell, and so everything about this is telling me lymph, but then I see these strange nuclear contours, right? These strange little kind of like things at the edge. They're not crazy, but they're not usual. And
Yeah.
then I'm looking at in the chromatin pattern some of these nucleoli or nuclear like remnants, right? um it's just something in my brain is like, yeah.
Yeah, I agree. Ooh, hello.
So I think some features carried over from the cell we just kind of looked at as far as the chromatin pattern is concerned. Yep.
This one's got a really large nucleoli. I mean, I might even look at that and think it's a prolymph.
Yeah. Yep. The other thing about that nucleoli too, and it could be a little bit of the video, but on this side here, down here, it looks like it's like flat almost, like it's got kind of like that flat edge. And that to me, the size and the shape, not good news.
Yeah.
So this would definitely go amongst my others as well. Yeah, well, they've earned a seat at the table too. I mean, how bizarre. To me, that doesn't look like a nucleoli, but more of a remnant or something like that. But even then, it just doesn't look.
In my first gut reaction is a vacuole, but it's not clear all the way.
So there's still that faint bit of
Yeah.
purple. So yeah, we have to use the coloration and the depth of color as a substitute for density and things like that, right? So this really does look like a hole in the nucleus, really, right? But it's not totally complete, right? Whereas the vacuole over here, we can see pretty clearly straight through,
Yeah.
very good. Yeah, that's not normal.
Mm-mm. And otherwise, he could just look like a quick little, almost reactive lymph.
Yes, yes, 100%. Yep,
But because of that weird vacuole thingy, like in the center.
yep. Very suspicious. Mm.
I don't know. He just kind of looks like a lymph to me.
Yeah, I agree, but I'm my eyes, I'm like, you get a critical eye when you start to see abnormal cells. So I think I'm fine with lymphing that one, but
Yeah.
skeptical. Yeah, it's tricky. I think on the conservative side, I just want to say lymph.
Yeah. I think I would just call him a lymph too.
Mhm. I don't like that you can't see much cytoplasm with that one. I also don't like the way that the nucleus is staining is a
That's,
little.
that's what I was gonna say. Yeah. I don't like the nucleus how it's staining. It's hard to see the characteristics of it, so I don't really know, but I don't like the way it's staining.
But and that's part of the problem too, right? So I think a lot of times people will point fingers at the stain. Oh, there's something wrong with the stain, or how the stain reacts with a cell is a product of the quality of the stain and the staining environment, but also a product of the cell. And with everything else looking pretty consistent in the rest of the field, that is a deeply troubling staining pattern. And I don't think we talk much about staining variations. But we should have a keen eye for that. That can be a sign of a malignancy.
Yeah. And I think that's important is the total quality staining, not just the staining of one cell.
Right. Yep.
So
Exactly.
because the one cell isn't staining well, it's probably a product of the cell and not the stain.
Yes. Excellent. Yep. Good point. Hmm.
Is it a mono? Is it a lymph?
Who knows? Yeah. So I think it's a lymph.
I think so too.
And I think I'm okay with just that call. But yeah. A lot of shaggy cytoplasms in this.
Yeah. I think it's a lymph. The chromatin pattern is really soft. So I don't know that I'd say it's a mature normal lymphocyte, but it looks lymphocytic in origin.
Yeah. Yep. Yep. Yeah, so Melissa's pointing towards the it's kind of a lighter color. It feels yeah, definitely less mature.
But because we know we're looking at abnormal cells, I'd probably lump him under the abnormal cells just
Yeah, I don't
because
think it's a bad. hmm Yep. I'm looking at the staining in the cytoplasm. I don't like that dark blue at the edge here. Um, and then it seems to drop off like our other cell. Um, the darkness in the nucleus isn't as bad as the bad one that we saw, so I might put this one in the other category as well. And some people watching this video might see a little bit of trepidation on our part to make a call one way or the other, and we're kind of in between. Don't get hung up on the iffy cells. Those are what they are, right? Someone might do a diff on one day and get less, and someone might do diff the next day and get more. that variability is much less important than qualitatively finding the abnormal morphology. That's what this really should be about. And this is going to be supporting testing, kind of assessing the tumor load, how much of this these bad cells are there. That's going to be flow cytometry on the lymph node biopsy and things. That's going to be way more important. Okay.
Well, on this patient, it would be taking, once they know the disease has moved into the peripheral blood, it would be putting flow on the peripheral blood to see how many are in the peripheral blood. And then, we would give our diff, and then the flow would tell us there's this percent, and then we would, know better going forward. Like, is this cell part of that malignant population, or is it just the normal cells reacting weirdly?
Yep.
Don't know,
Absolutely.
but it looks weird. So morphologically, we're lumping it under our weird cells.
Right. When you have the benefit of flow markers and being able to isolate and gate out those populations, I mean, that's the I love flow cytometry theoretically. I love it. It's so awesome. Such a cool testing, and really complements us on the bench. So yeah, great points. Doodle. Again, it's the staining in the cytoplasm that's I'm not a big fan of. Yeah. I think my net is getting larger and larger and kind of capturing some of these abnormalities. And I don't know, your thoughts?
Well, I think for that, it's better to err on the side of caution and say this could be part of the malignant population.
Yeah.
Let's see what Flo and the pathologists say.
Yep. Yeah, and then if the flow population ends up being far smaller, right, we can kind of rethink.
Well, then we might look back and say, okay, so maybe these were just reactive cells for some reason.
Yep. And having an immune system reacting to cancer is not uncommon either, right? So you can have a reactive process associated with
Yeah. I wonder if this one's almost normal though, because he's not too bad.
Yeah, it's not. Isn't that sad that we assess? This one's not too bad.
It's normal-ish.
Yeah, it's normal-ish. Yep.
Normal-ish.
It is worth noting we haven't seen much of other normal populations too, have we? So Nucleus, strange. We have the very weird staining characteristics. I think I'd put this in my my other category as well.
Yeah, I was wondering if it's mono, but it doesn't really have mono characteristics.
Yeah, then the strange staining. Yeah. Itchy trigger finger on my part, but yeah.
Yeah, I think I'd rather lump him under our abnormal cells.
Same.
Let's find one more.
Okay, we could do that. Yeah, white count is really, really low if we didn't talk about that. Cool. All right. So on the left, that cell, the lack of cytoplasm, deeply troubling. No thanks. There's also some weird stuff going on in the chromatin there. That's abnormal. The one on the right, not bad, I guess. What do you think, Melissa? What do you see on the right?
No, the one on the left, this one, it's got some interesting, like almost like a fold in it. It's got some really odd chromatin pattern. It looks like there's a nuclei like right over here. It's a little bit harder to see on here. Let me try.
But it does look like two lobes though, right? Like
you can almost see a little bit better where like the nuclei is.
Yep.
And yeah, I wonder if there's like a big fold or two in this one. Let me see.
Yeah.
No. Just one. It looks like there's like one like right here. Way over there.
So I feel like I see something like this. I didn't want to like draw too. I don't know.
On it. I was wondering why you were circling. Yeah, there's definitely some kind of like,
Mm.
it almost looks like lobes, like the coin over coin appearance. It's interesting. That's a weird one. That's a really weird one.
Yep. So that particular cell is one I have no reservations at all, but hitting the other category for sure. And then the one on the right is a little bit more boring, I think, right? It's maybe more
Yeah.
a better candidate for a normal lymph, if there are any normal lymphs at all in this smear.
I'm wondering if those ones that had the reactive look to them were just reactive, and then these are those mantle cell ones. But again, they're all just kind of weird. So I think I would want the pathologist and Flo to really look at it and confirm: am I looking at multiple populations,
Mm-hmm. Yep.
reactives and mantles and normal-ish lymphs? Like, because I wasn't comfortable with those reactive looking lymphocytes either.
Right.
But now seeing like cells like this guy here, I don't know that they're mantle cells.
Mm.
They just don't
Yeah.
look normal.
It's possible. I certainly would rather have a bigger net at this point, and then I'd much rather be wrong in the other direction.
Yes.
Over
Yeah.
calling.
Well, and I would definitely want to like tell the pathologist, hey, I don't know if there's two populations here or if this is one abnormal population. So either telling them or writing it on a sheet or whatever the
Mm-hmm.
practice is for your institution. But I'd really want to relay that message that there's definitely an abnormal population.
Yep.
This
Yep.
guy here, definitely. Maybe describe it and then tell them about another abnormal population, and that I'm questioning if they're two separate or one. I know when we met with the NOS and talked about reporting over in the UK, he was like, oh no, we'd be more descriptive and we would just describe the populations. At least for Dave and my institutions that we've been at, we wouldn't describe them as a report. We would describe them to the path, and then the path would do the actual interpretation and description and that kind of stuff. So I think I would just want to give the descriptions to that path so that they'd understand what I'm thinking.
Yeah, and having that description, I think, would be very valuable, because they're gonna see that, right? They're gonna see this, and then the weird colored stain, and then yeah, they'll get it. Yeah, really cool slide.
Yeah, this was awesome. I'm glad I had it.
Yeah, same.
I think that's all we have for this video. So thanks for watching.
Thank you for your time.
Please like, subscribe, and hit the bell if you'd like notifications whenever we post a new video, and feel free to reach out to us on social media or via email with comments or suggestions about future content. Thanks.